Australia has joined the list of countries banning arrivals from India. Flights are suspended until the 15th of May, and the Philippines is considering the same move. Daily infections in India continue to stay above 350,000. The surge is pushing the death toll towards 200,000.
I get maybe around 50 calls every day. Somebody asking for beds, somebody asking for cylinders, somebody asking for drugs. We don't have anything available and patients are dying.
The crisis and travel bans are prompting India's rich to flee the country by private jet. Tycoons and movie stars are paying high prices for flights to Europe and the Middle East. A one-way ticket to Dubai can cost up to $20,000. At the same time, vital medical supplies are arriving. Ventilators and oxygen equipment from Britain have landed in Delhi. More is expected from other countries. The World Health Organization has redeployed extra staff to support the ground response. Ishan Garg joins us live now for more. Ishan, is that international aid sufficient to help the country weather the current crisis?
Well, unfortunately, Dawn, we do not have the answer to that yet, because a number of countries have pledged to help India. The UK is sending about 600 pieces of equipment. The US has promised equipment as well as raw ingredients for vaccines. And at the same time, countries like Canada, the European Union, France, Germany separately have also pledged to help India, but that pledge is contingent upon the Indian government asking for that help, and the government has not so far asked formally for help from any of these other countries. So we do not have a clear estimate of how much equipment is going to be needed in the country. But at the same time, with 350,000 cases being reported, more than 300,000 cases being reported for 6 days in a row, the demand certainly is incredibly high. One research report recently showed that India needs about 14,000 ventilators, extra ventilators in this current scenario. And despite whatever help comes in from international countries, it's not going to match up to the demand that's been created because of the pandemic.
And Ishan, India has already seen lockdowns to cope with the surge of COVID-19. Are more expected?
Well, it's a yes and no answer. Essentially, yes, more lockdowns are expected, but on the state level. The new guidelines that have been brought out by the government say that in any particular district, if there's a positivity rate of RT-PCR COVID-19 tests above 10%, or 60% of hospitals in any district have been occupied, that particular district must be locked down. Now, the onus of locking that district down is on the state governments and not on the federal government. So it looks likely that a lot of states are actively taking this precaution and locking down districts which have a high positivity rate and their healthcare infrastructure is crumbling. So that's the yes part. On the no part, a federal lockdown across the country is going to be incredibly unlikely. The government has said this many times. It cited last year's example. It said that when a nationwide lockdown was imposed last year, millions of people lost their jobs. There was a massive economic downturn. So the cost to the economy is going to be great. So if we are going to see lockdowns, if we are going to see restrictions on movement, is going to be on very local levels, as we are seeing in New Delhi, where there is a lockdown in place for the past 2 weeks almost.
Ishan Garg there reporting live from New Delhi.